video, and today I want to talk to you about rotator cuff tears in the shoulder. What is it? How common are they? How bad is it? Is this something that needs surgery? Can physio fix it? Is there going to be pain forever? And a few other little things. So thanks for watching, and hopefully you'll find some information about this. So rotator cuff tears are quite a common complaint. This is something probably in the top 3 most common complaints that we see at the clinic here, especially in the probably 45 plus age group. So there's a few types of rotator cuff tears. So just to classify, firstly, there are acute rotator cuff tears that have happened usually as a result of an injury, commonly at work or in a fall, and occasionally trying to pick up something too heavy or hang off something, or use a sudden amount of force that can actually overload the tendon that much that it tears in an instant. So that's the first type, and then the second type is a chronic rotator cuff tear, which is actually really common, and it's a part of aging for a lot of people. It's a wear and tear condition where the tendon slowly gets weaker over time, wears thin, and to the point where there's some weak spots that get into the tendon, and they can actually then create splits within that tendon. So the chronic tears are really common, and that's probably something we want to talk about a lot in terms of when's the right time to have surgery, when's the right time to just do physio and rehab to get those sort of tears healed or in much better condition that they don't cause any pains. So, so firstly, acute tears. So if you've just fallen over or done something heavy and you've felt a sudden pain in your shoulder, and if you can't really lift your arm or do a lot of things with your shoulder, that's something that really needs to get checked out very urgently. If there is a complete rotator cuff tear where the tendon is actually ruptured into 2 pieces, that's something that definitely is not going to heal by itself. It needs surgery, and you've usually got a window of about a month if you want to have successful surgery on that tear. The reason for that is that the tear will actually, the 2 ends of the tear will kind of just pull apart, and the muscular side of the tendon is just going to pull away, and you're going to have a big gap between the bony part of the tendon and the muscular part of the tendon. That's tendon's just going to get smaller and further apart, and the blood flow is not going to quite be as good, and eventually it's going to be very hard for a surgeon to actually stretch that tendon back and to sew it on in a way that's going to hold. So quite an important thing not to ignore. If you've had a big shoulder injury and you can't lift your arm, I'd recommend getting to the GP. X-ray and ultrasound is a good start. There are a lot of limitations in ultrasounds, but for this particular condition I think it's quite reliable to pick something like that up. And then depending on the results of the scan, if there is a complete tear, off to see the surgeon. If it's a partial tear, I would say chat to the physio about what your best option is, and that'll be based on a lot of assessment, what you need to do, what you need to get out of your shoulder, and what we think, how we think you're going to respond based on people of similar age and other demographics. So the second one, chronic rotator cuff tears. These are actually really common, and a recent study actually showed about a quarter of all people have a rotator cuff tear in their shoulder, particularly over the age of 50, and actually probably 45 plus. The older you get, the more likely you're going to have a tear. But the caveat of that is that 2/3 of people with a rotator cuff tear, and we're talking full thickness tears, so which is basically a split that's gone from top to bottom through the tendon. So it sounds scary, but actually 2/3 of people who have a tear like that don't even know about it, don't have any pain, don't have any weakness. So that's an important thing to know. So often people have a type of shoulder pain, they're not sure why, it's just come along. They'll go get a scan and it will show a tear, and that can actually create a bit of fear. a lot of GPs even kind of don't quite know how to interpret that, and often they'll send people off to the specialist with a look to operating on that. So that belief is probably not quite correct. So basically, a lot of the time, people with either a partial thickness tear or a full thickness tear that's not complete will do really well with about 3 months of exercise and physio. So physio, we can do a bit of hands-on stuff to release some of the muscles that have been compensating. We've got actually a few different techniques that we might use to help that along, get rid of the pain a bit quicker, and then we'll give you a range of exercises and slowly push that along until you get stronger and your shoulder blade sits better and your shoulder moves better. A lot of the time, we're really quite successful with that, and that will avoid surgery. You'll have no pain and you'll be able to do everything that you want to do. So if you do have shoulder pain, consider physio as the first option before you look at anything like a surgeon or even a lot of scans and things. Usually we can get there without needing any scan, unless you've got a really big injury that means you can't move your shoulder. So can't say percentages, but it's really quite successful a lot of the time. And obviously, if we're not getting anywhere, that arms us with the knowledge. If you do need to go to a surgeon, we can then let them know what you've done, where you're at, and sort of cut to the chase. These type of surgeries aren't urgent; they can be done at any time. Actually, some surgeries aren't going to be successful anyway. So depending on the quality of the tendon, you really want to think about whether surgery is the right option or not. And we work quite closely with some really good surgeons who will have that chat with you and discuss whether surgery is the right option or not, as opposed to some surgeons who will probably just operate no matter what, as they believe in what they do and they think that they're going to be able to help everything, but unfortunately that's not always the case. So the other thing is some people come in with and they've had cortisone injections. Now this isn't probably the right option for someone with a rotator cuff tear. Usually there's a bursitis as well. So in the medical profession there's a common thought to say, alrighty, let's get an injection, get rid of that swelling in the bursa, and then your pain will go away and everything will be solved. But unfortunately this is usually a temporary fix, gives you a false confidence. You generally go and move your shoulder as though nothing's wrong, and invariably within 6 to 12 weeks your pain will be exactly where it was before because you haven't changed anything. And yeah, the tear's still there, everything's still weak, it's not moving properly, so the same thing that caused you pain in the first place is actually going to come back again. And the other thing is cortisone actually weakens tissues, so if you're putting cortisone into an area where there's a tear, that tear is going to have an increased chance of tearing even further or becoming softer and not taking load as well. So we don't really recommend that as a first option. Again, if things are progressing a bit slowly with physio and we think there's a bursitis that's really holding you back from doing your exercises, cortisone can work really well, but certainly we'd do at least 3 or 4 sessions of physio before we made that call, because there is a chance that it'll actually stop you from getting to the finish line or really slow you down for that long-term result. And again, it's a temporary kind of a fix. It's not really a fix, it's a temporary window of opportunity to help you get moving, but it will wear out, and if you don't do the things you should do, you won't actually get completely better. So we'll wrap it up there. Hopefully you found something interesting and useful. If you've got shoulder pain, write to us in the comments. Feel free to ask any questions. As I said, we do deal with this every day. We know the difference between what's going to go well and what isn't going to go well, and always happy to educate people on what they should do themselves. So thanks for watching, and chat to you soon.